the important attachments of the occipital bone. Here, external occipital protuberance, and this is external occipital crest. So, where is the attachment of ligament of Nuki? This one. And this is highest nuchal line, I told you. Here you will get the attachment of Gilia aponeurotica, and also on the lateral side the occipital belly of occipitofrontalis. Then this is superior nuchal line, this one superior nuchal line, and this one is inferior nuchal line. In the superior nuchal line, here medially, here is the origin of trapezius here, and laterally here you will get the insertion of sternocleidomastoid and also splenius capitis. So here three muscles. Here is the occipital belly of occipitofrontalis, then here is the sternocleidomastoid and splenia capitis, and here is the attachment of investing layer of deep cervical fossa. But in between the trapezius and sternocleidomastoid, this gap, here you will get one artery and one nerve. The artery is the occipital artery and nerve is the greater occipital nerve. Then come to this area between the superior and inferior nuchal line. Medially, here you will get the semispinalis capitis here, and laterally obliquus capitis superior here, obliquus capitis superior on lateral side, and below the inferior nuchal line and between this posterior margin of foramen magnum, this area, here medially you will get rectus capitis posterior minor here, and laterally here you will get rectus capitis posterior major. So all these are the attachments on the external side, and this is covered by Gilia aponeurotica. And this side is the falx cerebri, is the falx cerebelli, and the tentorium cerebelli. And on the inferior surface, here pharyngeal raphe on the pharyngeal tubercle, and rectus capitis anterior, the rectus capitis lateralis. So remember all these attachments on the occipital bone. What are the articulation of this occipital bone? Here the occipital bone, the condyle, two condyles articulate with the superior articular process of the atlas, forming atlanto-occipital joint. Then basi-occiput and sphenoid in front, forming one primary cartilaginous joint here, this one. Then jugular process on lateral side, it articulates with the petrous part of temporal bone in this way. So here is the articulation between this petrous part and jugular process, forming a jugular foramen here. And here this border or mastoid border articulates with the mastoid process, this one, forming the mastoid suture. And here there is articulation with the parietal bone, forming the lambdoid suture. The two parietal bone articulates like this. If you see this bone, here you can see this border and this border, they articulate with the parietal bone, forming this lambdoid suture. And this is the lambda, where three bones forming a fontanelle, that means posterior superior angle of parietal bone and superior angle of the occipital bone, forming the lambda here. This lateral angle, that means this lateral angle between this superlateral border and infralateral border, this angle form the asterion, and this is the asterion. Here the bones, this is parietal, this is occipital, this is temporal. This is another important fontanelle. Regarding ossification, not always asked, but sometimes it is asked, what are the centers of ossification? How many centers? There are usually 9 centers. 2 centers for the squamous part above the highest nuchal line and 2 centers below the highest nuchal line. 4. Then 2 centers for the condyle of this side and this side. Again 4 plus 4, 8 and 1 for the basilar part. Total 9 center. And another center called Cartering center. It is an occasional center of ossification for the posterior margin of the foramen magnum here. It is not always present, it is occasional center. Excepting this Cartering center, there are 9 centers of ossification. So, what are the venous sinuses related to the occipital bone? This is superior sagittal sinus, this one. And this one is called confluence of sinus, where the superior sagittal sinus turns as right transverse sinus. So, this point is a confluence of sinus and this is left transverse sinus. Here is a occipital sinus. Here is a groove over the jugular process. This is the groove for sigmoid sinus, this one. And on the lateral margin of the basilar part, inferior petrogenial sinus. And sometimes when you are asked to hold the base of the skull, here also you may be asked to show the different venous sinuses. You will show here the superior sagittal sinus, then confluence of sinus, then right transverse sinus, then sigmoid sinus, then here inferior petrogenial sinus, here is the occipital sinus, left transverse sinus, then left sigmoid sinus, and it is going as inferior petrogenial sinus up to the cavernous sinus. That's all. Thank you very much.